Okay. Oh yeah. A little bit of hot coffee out in the woods, talking to you about diabetes. So diabetes, the thing about it is that in conventional care, we're going to end up in the endocrinologist office. And this specialty is not great. The modern day endocrinologist is really looking at number, diagnosis, drug, right? If you have low thyroid number, you get thyroid drug. There's no investigation of causative factors, and they're not looking at the way that the physiology works together to result in the condition. They just don't do it that way. If they're looking at the sex hormone system, they're looking at the number, kind of like you have 10 apples, but you're supposed to have 12 apples, so we're going to give you 2 apples, as if it's a clean mathematical equation, which, especially if it's the sex hormone system, it's not like that at all. It's very complicated, and that's why it backfires so much of the time. Well, when it comes to diabetes, we want to kind of rethink it because, once again, they're basing it on a few lab values. And some of those lab values are very useful. Hemoglobin A1C is a 3-month window from which to see how the body's handling its blood sugars, and that makes it valuable. Elevated blood glucose is valuable, and even also elevated triglycerides. I'm going to explain that in a little bit. Elevated triglycerides, I would even add to the diabetic picture just very clearly if we're talking about labs that we want to look at C-reactive protein, the level of inflammation in the blood vessels. So I'm going to talk about diabetes, and I'm going to talk about something called hybrid diabetes or a hybrid diabetic pattern. It reflects what I'm seeing clinically, and we see a lot of this patient category. So let's talk about conventional care perspectives on diabetes. For example, most of you have heard of insulin resistance. All right, this is kind of a key concept in conventional care, and it's a real concept. But imagine that the furnace, which includes the tissues and the cells and the mitochondria that uptakes the fuel to make your body get energy, the receptors for those cells to take up the fuel, those receptor sites are rejecting the fuel. So that's called insulin resistance, because insulin is the hormone that's taking your fuel into the furnace, and your furnace is rejecting it. This is a core concept in conventional care, but I don't think it represents everybody with this diabetic pattern. And we want to consider it a pattern. It involves so many different organ systems. Think about it. We've got the liver, we've got the pancreas, we've got the kidneys, we have the adrenal glands, as you'll see as I explain it. We have the circulatory system, blood vessels directly, and blood flow, eventually leading to heart disease directly. We have the nervous system. We have the brain function, and immune system eventually start to go downhill. This is like a wrecking ball to the entire system, yet they're only looking at a few numbers when really diabetes is a pattern or a spectrum. And so we have to understand it based on the physiology. When we're looking at East Asian medical concepts, there really isn't a type 2 diabetic pattern specifically. There are a few different patterns to describe type 1, but type 2 is a lot more patterns describing these organs that are mostly involved, and that's individual per person. And so success has to do with understanding the physiology, signs, and symptoms that lead us to the organ systems for that person that are most in trouble, and then treating them so that they're back to health. But getting back to the insulin resistance, this is the idea that the fuel is being rejected by the receptor site at the furnace. Why I think this is fundamentally a problem is that we have a food supply that is so contaminated that it could be that it's not a broken furnace receptor site problem. Instead, it's bad fuel. Imagine you go to fill your car up with gas, and instead you fill it with a blend of half gas, half water. If your engine rejects that fuel, it's not an engine problem. Your engine's not broken. It's bad fuel. And that's one part of the hybrid diabetic picture. And that explains why we see so many people who might be 400 pounds. They're really overweight. They're suffering obesity. They're not enjoying it. Their body's overreacting to the food they're eating. They're not necessarily eating that much to explain it, right? It's not like they're eating all the time. Some people are, but a lot of people are not. It's an overreaction. It's a metabolic dysfunction, but their labs look normal, right? They're normal and they're 400 pounds and they're having swollen ankles and lethargy, tired, fatigue. They can't get through a day, sleep disruption, joint pain, and the doctor says nothing's wrong with you, right? They need to wait till it's on paper to treat it. They need to wait till the patient gets worse in a way that triggers a diagnosis that's not based on physiology, it's based on just a number, and then you get the drug. And in this paradigm, it's considered that there's not enough insulin to jam the fuel into the furnace through the receptor sites. But in fact, nothing could be further from the truth. These patients are hyperinsulinemic. They're already producing too much insulin relative to the amount of fuel being put into their body, right? They're overreacting with elevated insulin, and that's measurable. But to get away with the drugs they typically give, they don't check insulin levels. I do advise you, if you're going to get some labs, add that to the mix. Check your insulin levels. And remember, insulin is a hormone that is anabolic. That means growth, right? So insulin is putting things into the tissue. Whether it's healthy, putting it into the furnace, so we got fuel, putting it into muscles, it makes things grow. And if there's some sort of dysfunction, then it will put it into fat cells. We're still anabolic. And that's why it's related to cystic development, cystic acne, cystic ovaries, because there's a growth mechanism that's no longer in control of the brain. So things are growing out of control. I love coffee. So if we back up from the insulin resistance concept and look at why the body would be overreacting with high insulin, right? That becomes the question. And to ask the question, we must start with the fundamental philosophical position that the body is not stupid. It's a miracle. If it's doing something, we should be asking why it's doing it. We shouldn't just treat it like it's dumb and rip it out, shut it down kind of butchery that we see so often in conventional care, ending up on 5 drugs and you feel like you can't get through a day because they didn't help your body get better. They just made it sick. They did triage. They managed numbers. So here's what's happening. Your fuel comes into your body. And let's talk about the carbohydrates, which are going to all turn into sugar, right? So we also have fat and we also have proteins when we're speaking of macronutrients. I'm going to do a whole nother video just on macronutrients. That's protein, fat, carbohydrates. Micronutrients are your vitamins and minerals. But let's take a look at like our carbohydrate. It's a high fuel source. And so it's going to be readily available and we eat our carbohydrates and we can go move our body. That's at least how it's supposed to work. So you have some carbohydrates. All carbohydrates turn into sugar once they're in the bloodstream. And then the body produces a little bit of insulin, that's normal, to escort it into the furnace so that you get the energy. Now let's say that you can't use that amount of fuel. Maybe you overate or maybe you're just not moving your body enough. So the body's going to try to put it into the furnace, but if it's not needed there, your body can also put it somewhere else. So we have the furnace, and then we have the liver. It can be stored in the liver as a snack called glycogen for later. So you ate a little bit too much or your body didn't need it, you put a little bit in the furnace and then the rest it's like, let's just save it for later. And then an hour later when you're not eating, that snack draws down and you have usable energy, and so you have no fluctuating energy levels and no cravings. Remember, cravings are a key sign that there's a blood sugar instability because you're kind of spiking and dropping with your blood sugars. But if your snack system is working the way it should, it feeds back into your supply very efficiently so you don't get that drop. You don't get any of that hypoglycemia, which is part of the diabetic picture. Okay, now what if your liver is also congested? So now you got this liver that's not a diseased liver, it's just backed up. It's not really detoxifying the way it should. It's not managing its glycogen stores the way it should, or there's already too much. And so what's going to happen is it's going to spill over into your triglycerides. So you're going to start to see in this patient the triglycerides start to elevate, not all the time, but very likely. And then that really is part of what can convert into fatty liver. But if it's not going into the furnace and it can't go into the liver, the ultimate place that causes the elevated insulin is that these sugars stay in the bloodstream too long in too high amounts. And when blood sugars are elevated in the blood vessels, it inflames the lining of your blood vessels. When your blood vessel lining gets inflamed, that's when your brain freaks out, because now this is a vascular dilemma. This is a priority now. And so now the body is highly motivated to get that junk out of the blood vessels. And that's where you see the hyperinsulinemia. Elevated insulin relative to the amount of the food coming in. You're overreacting because your body's sensitive and it's saying, get it out of here. Almost like the person with an irritated bowel, they might even be eating some good food, but their gut is so sensitive, they're getting the sense of urgency stool, like they gotta go right away because they're inflamed down there. And so their body's sensitive. It just doesn't even want food, even if it's good food. Same thing is happening here. So your body's pushing that high insulin as an inflammatory reactive response to get those sugars out of the bloodstream, and now two new pathways are gonna open up. One is that it's gonna convert to fat. Your body can just always throw it into a fat cell and it saved the day. But now you're having weight gain, and that could be a problem. That's not good there. And that's why weight gain by itself may not be a direct problem, but it's overall a picture of a vascular inflammatory response. And it's good to note that the diabetic pattern itself is the #1 leading precondition leading to heart disease and stroke. This is important. So the two pathways are you're either going to start gaining weight, abnormally gaining weight, like you're not eating that much and yet you can't lose the weight, or you gain the weight. Days that you eat less, you're still not losing weight because you're hyperinsulinemic and your body's in that fat storing anabolic switch. Remember, you're anabolic. As long as you're anabolic, you can't break down those tissues. That's called catabolic. We're going to get to that. Catabolic is where you get to break down tissues, hopefully fat, because you don't want to catabolize muscle. You don't want to lose muscle. Okay, so we're either gaining weight, or the other pathway is you start to urinate out these sugars. So this is the person who may not be gaining weight, or you can go back and forth, right? They were gaining weight, now they're not, or they weren't gaining weight, but now they are. But here are the symptoms. You start urinating it out, and now you're peeing more. You're having maybe nighttime urination. If you start to urinate out those sugars, that's called glucoseuria. It's measurable. But even if they do a urinalysis and they don't see sugar in the urine, if you're having increased urination, especially nighttime urination, especially urinating more than once a night, then you're peeing out sugars, or you're about to pee out sugars. Like the mechanism is being triggered and you're flushing something. That's why you're urinating at night. Remember, sleep is a priority. So if your body's waking you up to urinate, then whatever's irritating your blood vessels that needs to be flushed out through the urine, now that's the priority. And if you continue doing this, you're going to be slowly irritating your kidneys and your ureter and bladder, that whole system, and that's going to lead to urinary tract infection susceptibility, eventually kidney stones and blood pressure issues, maybe even gout. All of that's part of this precondition. That all starts with this kind of increased urination, because you're flushing out something and it's tearing up the kidneys. Think especially if you're waking up with cramping in your calf muscles or feet. That means that you're flushing out so hard, you're peeing out more than you took in, more fluid than you took in. You're actually pulling fluid from your tissues, causing dehydration and a disruption of electrolytes, and that's causing the cramping. Why would your body do that? Because it's so irritated, it's dehydrating you to flush out the irritation. Same with, like, if we talked about the irritated bowel and you're having some loose stool, your sense of urgency, you're flushing out some bad food. Well, it's gonna pull in water into your colon to irrigate it. Well, where'd the water come from? Your tissues. So in an adult, no big deal, but in a kid, that dehydration could be life-threatening. The concern for the adult is that you're irritating your kidneys over time, and that's not good. All of these signs and symptoms are so important, but the regular MD or endocrinologist specialist, they're not going to ask about any of this. In fact, if you go to them with the UTI, they're just going to give you an antibiotic. They won't even ask you about cause. They won't even ask you about nighttime urination or cramping in your calf muscles. They have no interest in any of that. You go to a natural person who's untrained and they're going to say, take some, minerals, calcium, magnesium, potassium. Well, that will help with the cramping in the calf muscles, but it's not taking care of the cause of it, which is that your body is stressed, you're having systemic vascular inflammation, and you're trying to regulate it by peeing it out. That's not going to help any of that. That's just going to help the cramping in the calf. Better is to treat the root cause. Okay, so the important concept here is to think about that vessel inflammation being the primary trigger point for that overreaction of insulin. It's the sugars in this model I'm telling you about that are causing the inflammation. It's true, they're not going where they're supposed to go. That could be partially insulin resistance, which is the conventional care model, but it could also be the bad food. The food itself is being rejected because it's not good food. But let me add another layer to this that's going to really click for some of you. Let's say that your blood vessels are already inflamed before you even eat. You're walking around with systemically inflamed blood vessels. And to be clear, I'm talking about the endotheliolitis, right? Inside your blood vessels is a very sensitive lining. So that's inflamed. You've got systemic endotheliolitis. That's going on for something other than food causing it. But with that already happening, you go to eat and you're going to overreact to the food. You're going to have this hybrid diabetic pattern because your body is overreacting and it's using high amounts of insulin, but it's really not caused by the fuel itself or the food. It's caused by something else that's irritating your vessels other than food. This was clearly going on with me. There could be several different causes to that vascular inflammation, but for me, it was my gut health. I want you to think that the gut is a massive system. I was under a tremendous amount of stress. I'm having, tons of gut issues. I've been in the past hospitalized for gut issues, colitis, hiatal hernia. I don't have any of those conditions at this time. My gut is very healthy right now. But that was causing a lot of problems for me at that time. And what the result was is that your gut that has a massive vascular system uptaking all the nutrients into your blood supply. When we're talking about the gut, you have to realize that the gut is a huge filter. Yes, we have the upper GI tract, which is trying to break down the food and disinfect it. That's like your stomach acid, the pancreas, the enzymes, the bile. These are preparing your food. But once you go downstairs to the lower GI tract, it is a massive filter. Your small intestines are a 22-foot filter trying to make sure that you're only taking in perfectly clean nutrients and you're keeping out the waste, which goes into the colon and becomes your bowel movements. That's your feces. We don't want that. But if that filter is irritated, if your gut is irritated, then you've got some degree of that leaky gut concept, meaning that going from your 22-foot gut, some of the contaminants are not being fully filtered out and they're going into the bloodstream, and the next stop is the liver. And so we're getting that congested liver, which is part of its blood sugar regulatory issues to begin with. You got a congested liver, it starts to malfunction in more than one other area, including storage of glycogen and conversion to sugars and fat to fuel. All of that is handled in the liver. The liver is a major player with the diabetic pattern, yet you'll never hear them support the liver. Not one way or another. They're not even interested in it. Unless you have severe liver disease, they're not even going to bring up the liver, but it's like a major organ for the diabetic pattern to consider. Well, now that your gut is sending a bunch of extra junk to the liver, if you're a gut case like I was, well, now the liver has that tipping point where it can't manage that extra debris and burden of detoxification, so it starts to hit the rest of your bloodstream. And now we have systemic vascular inflammation from gut issues and congested liver before you even eat your food. And that's going to trigger a hyperinsulinemic reaction. That's part of the hybrid diabetic picture. This is just a concept, but I want you to expand that to other possibilities that can be part of the pathomechanism. Maybe it's other forms of toxicity, you're around chemicals, burden of detox just to the liver, could be impaired blood flow itself, maybe you've been exposed to spike protein, could be a lot of factors. Why did we see so many people gain weight or get urinary tract symptoms, kidney stones after getting COVID? Because the spike protein was floating around the bloodstream, causing inflammation so that they became that hybrid diabetic pattern. So if you remember the video I made at the time, I was talking about stage 1 of COVID was the immune response, stage 2 was blood flow impairment, circulatory issues, vascular inflammation, stage 3 was a diabetic-like reaction. That fits exactly what I'm saying here, but that may not be the picture that you're going through right now if you can relate to any of this. Point being is that we may want to have a treatment strategy that also includes decreasing vascular inflammation and improving circulation just to treat the diabetes. But they don't think that way. In fact, some of the drugs are designed to make the pancreas produce more insulin. Yeah, I know, that's crazy. So you've got a stressed out pancreas that's already hyperinsulinemic, but they interpret that as not enough insulin to jam it into the cell, into the receptor site and into the cell. So they give you a drug like glipizide or something that's going to make more insulin from the pancreas. And what this does is it stresses out the pancreas. Now, they do this because momentarily it does work. And work is defined by your blood sugars going down. They could just tell you to eat less carbs, but why change your diet? Instead, they give you a drug that's making your pancreas sicker, but the numbers get momentarily better. And then when your pancreas starts to die off, they call that the natural progression of disease, but in fact, it was negligent medicine because they killed off your pancreas and they didn't change your diet, and it was largely dietary, and they didn't look at any other factor or consideration in cause and mechanism. And so they just gave you these one-size-fits-all drugs because that's what they give everybody, no individualization. And as you're getting sicker, now you need to be on insulin. They have effectively at that point turned a type 2 diabetic patient into a type 1. Remember, a type 1 doesn't produce insulin. It's not caused from diet, it's caused from something else. Could be they were born that way, could be an autoimmune reaction. We saw a lot of people with COVID spike protein damaging the pancreas and having a type 1 flare-up or episode or a new occurrence of type 1 post-COVID infection. There could be a lot of reasons for it, but it's not dietary. Management of it requires dietary considerations. But unlike the type 2 presentation, which is directly influenced by diet, even if it's the poor food supply, it still has a lot to do with diet. You can lower your carbohydrates and get no treatment and still have some great success, far better than seeing the endocrinologist when dealing with type 2 diabetes. Better is to treat the underlying cause and the patterns, the systems involved, the liver, the gut, the kidneys, the vascular health. All of those need to be considered. But this concept in medicine where they give you a drug and then as you get side effects, they blame the side effects on the natural progression of the disease, this happens over and over again. Your body makes cholesterol. This is part of the picture, is to have a little bit elevated cholesterol. It's pretty common for this sequence because the cholesterol is being made by the body. Remember, the body's not dumb. It's producing the cholesterol to calm down inflammation in the blood vessels because that's the priority. But instead, they give you a drug that's actually going to just force the number down. Now, here's the deal. Your cholesterol is produced by your own body. It's not the cholesterol you're eating that just turns into blood fats. It's not that way. Your cholesterol, 80% of what's floating around in your blood vessels is produced by your own liver. So they give you a statin drug which damages the liver and requires follow-up testing to make sure that your liver's enzymes are not elevating because the drug is so damaging to the liver. When in doubt, go back to the physiology, go back to the way God designed the body, and then ask yourself, what's the pathomechanism? What went wrong, right? What's in trouble? What system is struggling because something's in the way of normal function, and we want to remove what's in the way of normal function, and that might be lifestyle medicine, and then we want to support it back to normal function. There aren't any of these drugs that are the treatment strategies to actually get your body working normal again. It's not doing that. They're interrupting something. It may have short-term benefits. It may even be life-saving, but there's no exit plan because it's not fixing anything. and there's always going to be side effects. Okay, I think we caught it for today. That's enough. So if you have any questions, put it in the comments. You can always come and see us, make an appointment through our website, and I look forward to helping you and giving you more good information so you can think through this stuff and be empowered. Okay, bye.